Did you know that dengue is a debilitating mosquito-borne disease caused by 4 types of dengue viruses? This illness is transmitted by the bite of an infected Aedes mosquito, which becomes a carrier after biting a person with the dengue virus in their blood. Fascinatingly, dengue can't be spread directly from one person to another. Now, the symptoms of dengue fever usually commence 4 to 6 days after infection and can last for up to 10 days. These symptoms may include high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, fatigue, nausea, vomiting, skin rash, and mild bleeding. It's important to note that these symptoms can sometimes be mild and mistaken for those of the flu or another viral infection. However, serious problems can develop, such as dengue hemorrhagic fever, a rare complication characterized by high fever, damage to lymph and blood vessels, bleeding from the nose and gums, enlargement of the liver, and failure of the circulatory system. The symptoms may progress to massive bleeding, shock, and death. This is referred to as Dengue Shock Syndrome. Dengue is diagnosed by doctors through blood tests that check for the virus or antibodies to it. The mosquito responsible for dengue is dark-colored with typical white markings on the legs and lyre-like markings on the thorax. It is significantly smaller in size than its counterparts. The only way to differentiate between a dengue mosquito bite and a normal mosquito bite is that the former is much redder and itchier. A critical component in a dengue patient is the platelet count. A healthy individual typically has 150,000 to 400,000 blood platelets. Dengue can cause a decrease in platelet count, leading to a condition known as thrombocytopenia. This condition can increase the risk of bleeding and hemorrhage, making monitoring and managing platelet levels crucial in dengue management. Treatment for dengue often involves a blood transfusion to enhance the low platelet count. This procedure helps increase the platelet count and allows quick recovery of the patient. Consuming the right foods can also help naturally increase the blood platelet count. Prevention is always better than cure, and the best way to prevent dengue is to avoid bites by infected mosquitoes. In 2019, the FDA approved a vaccine called Dengvaxia to help prevent the disease in adolescents aged 9 to 16 who have already been infected by dengue. However, there's currently no vaccine to prevent the general population from contracting it. Remember, if someone in your home gets dengue fever, it's crucial to be vigilant about efforts to protect yourself and other family members from mosquitoes. Always consult a doctor for professional medical advice. Subscribe and share this information with those you care about, because to reset your life, you need to reset your health. Thank you for tuning in to Channel Health Alerts.